Hi everybody. As I think we've already said, we hoped we wouldn't be back having to do these, but as we know, the next step was taken, and there was a mix of messages. I fully understand why the government did what they did. I don't think the messaging necessarily has helped. And whereas they've removed most of the legal restrictions, they have continued to urge caution and issued guidance, similarly expressing similar caution and needing lots of the other issues still to be followed. So they've urged that individuals take their own personal judgment and make their own informed decisions. I think we've all been going through this long enough to individually know where we feel comfortable, where we don't, what's good, what's bad. My referring back to us in the first few clinics to our own experiences going to supermarkets, I think comes into play, where we saw those that were still continuing to urge caution and use judgment and those that went. So in many ways, this is a continuation of the same. So guidance has been issued by government, through Managing Safely, which is part of the Health and Safety Executive Guidance, but also through government guidance on reopening leisure centres. And they've asked specifically that all organisations need to look at the priority actions they need to take to continue to protect themselves, their staff and their customers. So you still are required to complete a health and safety risk assessment that includes the risk of transmission of COVID-19 and or any viral infections. So you are required to do that, and not a lot will have changed. We know that more people have been vaccinated, so that there's less of a risk of people dying or hospitalisation, but there's still a risk of transmission. As Caroline knows only too well, going out to pubs or to supposedly safe fan zones or going to stadium 2 weeks ago hasn't exactly had the best of implications for people, and transmission rates have continued to rise. So we need to make sure that we are still turning people away who have got symptoms, advising people not to attend if they've got symptoms, making sure we've got adequately ventilated rooms, and we'll come on to all of this in more detail, cleaning more often. This is as much to do with the risk of other viral transmission and bacterial transmissions, the fear of seasonal flu, of winter vomiting, which we know is already on the increase, and government are worried that, having not been exposed to it for nigh on 18 months, the health service is going to get overwhelmed by that, and our businesses will get overwhelmed by it, with staff being off, not knowing whether it's COVID or flu. And therefore we do need to make sure those precautions remain in place. Enabling people still to check in at your venue. We know it's not legal, but it's guidance and we think it's good practice. And the last point, to communicate and train. And Caroline said she hasn't been out to centres. A number of us have, and a number of us witnessed already that clearly operators aren't communicating to their staff some of the key principles that still need to be maintained. So one of my colleagues went into a spin studio, which still was only half full. Now, whether that was because they planned it to be half full, but the instructor clearly hadn't been told they needed to keep people distanced. So everybody was still on the bikes next to each other, all at the front, all a lot closer than they had been. So it was pretty pointless having controls in place on numbers if they've then gone and not communicated to the instructors. They still need to follow common sense, basic issues that control the risk of transmission. So that is really key to making sure that we communicate what you're doing to your staff. Next slide, please. The UK government has issued advice. Now then, through the Health and Safety at Work Act in the UK, this crosses all devolved governments. We still don't have any updates on what the next steps are for Southern Ireland, but for certainly all of the UK, the Health and Safety at Work Act covers everybody, and employers still have a legal duty to manage the risks to those affected by their business. The way they do this is to carry out a health and safety risk assessment, including the now foreseeable risk of viral transmission, COVID-19, with the corresponding risks still to certain parts of the community of death, and also the risks of long COVID. And that's a risk to you as businesses in terms of numbers of staff, as well as to the individuals themselves through illness. So next slide, please. You as employers are required by law still to protect your employees and others from harm. So the Health and Safety at Work Act states it's your duty of every employer to ensure, so far as reasonably practical, health and safety and welfare measures at work of all his employees, and to ensure the duty of every employer to conduct the undertaking in such a way to ensure, as far as reasonably practicable, the person not in his employment are not affected by your actions. So its basic law still applies to you all. We've got this known risk, and you still therefore have to take measures to try to control this. Next slide, please. The management of health and safety regs goes on to state every employer should make a suitable and sufficient assessment of the risks. We've already talked about that. And this means that as a minimum, you must identify what could cause injury. In this case, it's viral transmission, decide how likely it is, and then take actions to eliminate and control the risks. Okay, next slide, please. So that's the basic bits about the law. It's therefore important that your risk assessment is suitable and sufficient and considers the different ways viruses can spread, aerosol being the predominant one, droplets and surfaces still being around, but it's predominantly the aerosol, and put in place measures to reduce the risk of each type of transmission. In the coming weeks and months, review your risk assessments regularly if the gradual lifting, as we continue to gradually lift restrictions and you get more confident in the controls that you've got in place. Now then, we do think in the coming months, once we've perhaps been through this next wave and we're into September and hopefully things have settled down further, that you will be able to start building these into every risk assessment you have. So that just like you have in all your area risk assessments or your activity risk assessments, you have the risk of, say, electrocution, you will begin adding in the risk of viral transmission and putting alongside it the controls you have for each room. That could be ventilation based, or the other controls you have for cleaning and social distancing, if that still is appropriate. So eventually
Ian,
you begin. Yeah.
May I interrupt? It's Mike here from Flip Out. Just in relation to your last point on adding these additional measures into individual risk assessments, I literally, the signal must have dropped out over the last sort of 10 seconds. Can you just confirm what you said about adding the additional measures to each individual risk assessment, please?
Yeah. Okay, I will do. If people have got questions that come along, if you put it on the chat, I'm watching the chat and therefore I can pick it up. What I said was that in due course, you will need to do this. At this point in time, we probably think it's important just to keep your overlay because things are still changing so fast. Once we begin getting a more stable and settled situations, probably in the next 6 months, hopefully, you should begin building this into your everyday risk assessments because it's a known risk, it's foreseeable, it's not going to go away, and that you can therefore build it in as we go forward into your basic risk assessments. Hopefully that answers the point that dropped out for you there. So you should also just note that whereas the legal restrictions have come off in many places, the legislation remains in place that local authorities still have the power to act under public health restrictions on businesses. So if they think, and I can see this, if we've got nightclubs that are poorly ventilated and they suddenly get lots of issues relating to that, public health still have got the power to go in and close those businesses down or put prohibition or improvement notices on what they do. So it is important, if you get lots of issues linked to your businesses, you will still get investigated, and the local public health still have got powers to enforce. So I think that's important to remember. Next slide, please. I think we've all been watching with anxiety the increasing rise. They said it would, so I think we should bear in mind the case numbers. We're now up to an average of 47,000 tested positive each day. They've said it will go higher. I think one of the key things I heard is that if we don't see that number begin falling by mid-August, so wherever it gets to 100,000, 200,000, if it isn't falling by mid-August, I think we should all be aware that we might anticipate renewed restrictions. So I think it's incumbent on all of us as individuals as well as businesses to try and help keep protections in place so that we don't end up with further restrictions in place. 4,500 people are currently in hospital, and that's a massive increase over the previous 7 days. There has been an average of 342 deaths. There have been 342 deaths within the last 28 days, and I think we all saw yesterday's numbers of 96. Now, I know that's a bit of a catch-up from the weekend, but that death rate is still continuing to grow. So it is still there. We still need to take precautions from it and make sure that we do all we can to contribute to the effort to make sure that we aren't under new restrictions come mid-August. So next slide, please. We know that to date, 96% of all over 50s have been vaccinated, 83% of all over 50s have also been vaccinated. There are still 35% of 18 to 30-year-olds who have not been complete or who are completely unvaccinated. And I think we need to look at the age profiles of our staff and ask ourselves, have they been vaccinated? Are they putting themselves and us at risk? We need to think about customers too, how many are under 30, and consider that within our risk assessments. Vaccine passports are not yet a requirement for leisure facilities, and I stress yet. There were hints yesterday, obviously they're going to put that in place for nightclubs. That's an encouragement as much for the young to get vaccinated, as well as probably the more affluent and middle class who all want to go off on holidays abroad and therefore want their second vaccines. So I think let's hope that we do all we can, that we don't fall into that, but it could be an issue that could fall into place. Make sure you encourage your staff to get their jabs if they haven't already had one. I think they only need to look at the numbers of people around the country. The older people have all had their second vaccines who haven't been negatively affected by having those vaccines. And I know Caroline is self-isolating, probably thinks she might have it, but the symptoms are very mild, and perhaps that would have been very different if she hadn't have had that second vaccine or been fully vaccinated. So next slide, please. Right, our favourite person on television, Jonathan Van Tam, has advocated that we still think very strongly about what they're doing in Japan, the 3 C's. So still try to consider and avoid closed spaces. Closed spaces where ventilation is poor will enable the transmission of COVID-19 more easily. Crowded places where lots of people can gather, so the fan zones 2 weeks ago, or the stadia, where I know somebody who went to Wembley who said that the checks and balances in place there were perfunctory at best, if not non-existent, clearly helped the rise in transmission rates at the moment. And close contact settings where there may be more close contact between people. So this whole thing of meter distancing still needs to be considered and taken into account to help us continue to avoid, where possible, and help suppress the risk of viral transmission. Next slide, please, Jan. Oh, Jill. So there's a whole load of questions still left. Social distancing restrictions are being lifted in England and Wales. In Scotland, you've still got physical distancing in level 1, but there's been reduced to 1 metre in all indoor public settings. It's been removed, but the guidance still wants us to think about that. So we still have to think about the implications of the risk of viral transmission, not only from a legal viewpoint, but also from the implications for customer confidence and them coming back. Also for your staff, are you going to end up with more staff being off, having been told to socially isolate for the period of time, and the negative consequences on your businesses of shutting as opposed to just abandoning all the controls that you had in place? I think it's a question of gently slowly reopening and building confidence of your customers, staff, and seeing where that balance point is between safe operation and causing rises in COVID transmission within your area. I think you need to continue to consider pinch points. So where you've got areas where people queue or are densely waiting to go into classes, they still need to be considered. Do you still advocate the wearing of face coverings for that? And we'll come on to that in a minute. Positioning of equipment, think about aerosols. Floor markings. We had a conversation with one of our clients the other day where they were talking about this, and they had a varying views of people who actually liked the fact that in classes they were told where to stand. Now then, you might increase the capacities, but you might also still keep the space areas that people work within and make those slightly smaller or slightly closer together, so you can up your volumes slowly. But I think there might be an issue of customer confidence where there's a bit more regulation around how they exercise in those spaces that might continue to help you avoid too much social contact. And you may wish to encourage staff and customers to avoid close social contact areas. Next slide, please. I know we got loads of questions coming in, and we will do our best when we get to that point to be answering those on the chat. So we will get to some of those. Yeah, sorry, Jill.
Ian, I think there's quite a lot of questions that are the same, so I think the best thing for me to do is clone them for you, and hopefully we will get through everybody's questions.
Hopefully we'll deal with some of those because we haven't covered all the points. No, some of them will be covered. So.
Yeah, absolutely.
Okay.
Keep those questions coming. It's probably more questions than we've ever had so far. Obviously, we need to cover that for you, so please keep those questions coming.
So if you reduce the frequency of cleaning, will your standards slip? Will you again affect customer confidence if they don't think the facilities as clean as they have? I know from having been around most leisure facilities that I've been in, have been the cleanest I've ever seen them. And hopefully that gives a good impression of our industry and will help not only for now, but for ongoing future. So let's try and keep those standards up and think about how you've done that and to do it in an effective and efficient way. We've talked about customer confidence. Again, if you're just reopening changing rooms, you need to think about the critical areas within that. Are you allowing, if you're going back to full numbers in your pool, how are you managing your changing rooms to keep those contact points and those close contact areas? So I think you still need to consider those within your risk assessments. Consider continuing to encourage customers to clean equipment between use and perhaps expand on that as to how they clean them. So we shouldn't just expect customers to know they just get a bit of blue roll and wipe it down to remove their sweat, but actually to use the sanitizing solution that you placed alongside it and the length of time that the sanitizer should be in contact before being wiped off. Personal equipment and sharing of equipment, while permitted, consider how it's cleaned. Generally good hygiene and not just for COVID, but also consider whether you're going to place that onus on customers or whether you're still going to use staff to do that in between uses. And think about other virus and bacterial spread. As I said earlier, there is a fear that seasonal flu and winter vomiting, which is norovirus, is going to spike up during the winter months, which is going to add extra pressure on the NHS, reduce people coming through your doors, affect your staff. So I think it's vitally important we continue to consider and advocate good hygiene and practice good cleanliness standards. Next slide, please. So hand sanitizing, we would continue to advocate that you've practiced good hygiene practices and that you continue to offer sanitizing facilities for customers and encourage their use before and after activity. Continue also to regularly check toilets and changing rooms to ensure there's adequate soap and hand drying facilities and that they're stocked is something that we think is vital to us not becoming part of the problem going forward, but to continue to keep customer confidence and have safe facilities. Next one, please. Face coverings. No longer law. We do know, though, that it is being strongly encouraged by government that people should continue to wear them in crowded and enclosed spaces. We know that 2/3 of the country still advocate wearing them. I've been into supermarkets, my old chestnut again, and into other spaces where the majority of customers and people I've seen still wearing face coverings. Having said that, a colleague of mine went into a leisure centre the other day where it looked like complacency has set in and it's not being advocated, and very few people were wearing them while moving around. It's up to you to set the standard. It's up to you now to set your control measures and to put information up to try and extol the virtues of following what you want them to do. If you've got large facilities with very few people in, you might think it's not necessary. If it's enclosed spaces, though, and you've got areas of contact, we would still advocate that you encourage customers to wear it, particularly when moving about. Clearly, if maybe they get onto the pool balcony to watch their kids swimming and they're distant from people, you might be able to suggest they can take it off. But we would strongly advocate that while moving around, we still try to encourage customers to adopt what we're seeing in other venues. Let's not be different. As we know from the previous guidance, we shouldn't be wearing face coverings while taking part in strenuous exercise. In Wales and Scotland, they're still to be worn in most public indoor spaces. Customer confidence is important, and as we said, we should still continue to advocate them, and certainly for staff as well when moving around. And I would still strongly advocate the use of screens so that the receptionist behind, if they're not close to other staff, can actually be seen properly and be able to talk and interact with the customers through the screen rather than having to wear a face covering. Next slide, please. Ventilation. We know that aerosol transmission is the main way the virus is transmitted. We also already know how important ventilation is in reducing the risks. Poorly ventilated spaces should be identified within your risk assessments. Steps taken either to improve ventilation, make sure only a few people are in there, or not to use those areas. And while we're no longer required to measure airflow or to apply the 100 person per square metre, we still have to consider the implications of poor air quality within the areas. The information provided on the government guidance and the health and safety guidance on ventilation strongly advocates the use of CO2 monitors. If we could move to the next slide, please, Jill. And while CO2 is not a direct measure, it still gives a very good indication of the amount of CO2 emissions within an area and how quickly it's being cleared. We know that the HSE have stated very clearly that anything over 1,500 parts per million of CO2 is an indicator of a poorly ventilated room. Having said that, within further guidance from government, they have indicated where there is high levels of physical activity, dancing, playing sport or exercising, providing ventilation sufficient to keep CO2 below 800 parts per million is recommended. So I think a number of you already have gone down the lines of getting the correct NCIR CO2 monitors, to get those with the capability of looking over a period of time how the CO2 in rooms goes up and down should help you look at your risk assessments and determine whether the rooms that you're currently perhaps having exercise classes in are adequate to control and keep to below 800 parts per million, or whether you're going to be exceeding it regularly, in which case you need to take the decisions about whether the room is adequate, whether the numbers in it could be reduced to bring the numbers down, or whether you can improve the ventilation within that room. And I think this will be one of the keys that the HOs will be looking at if they come in with an enforcement hat on, to look at how you're keeping below the 800 parts per million in rooms where physical activity is taking place. And we've got a link there to that guidance that's on the HSE website. Okay, next slide. Whereas again, this isn't law. We strongly advocate, as well as government, encouraging people to continue to still use the NHS QR code for customers wishing to check in. If you're not using that, you should have a system to collect names and keep it still for test and trace, and still try to keep to the original guidance. I think it's important, if we are going to control this risk, that we continue to try to help government control the risks of the case numbers getting out of control again and putting additional loads on the health service moving forward, and affecting your own businesses by staff having to self-isolating. Next slide, please. So testing. You may consider asking your employers to keep testing regularly. Lateral flow tests are available free of charge still. Any employees with symptoms should immediately self-isolate and get a PCR test. And close workplace contacts should be asked to self-isolate and get a PCR test. Your local authority public health team should be informed if a positive test is confirmed. Now, this is a change over what was originally in place, but it's something that you should be doing if you have a positive test confirmed amongst your staff. So people identified as contacted cases are at least 5 times more likely to infect other people. And even if they have been vaccinated, there is still a significant risk that they can pass the disease on, as we've seen through our new health minister being able to contract it after having been double vaccinated. We fully appreciate and sympathise with businesses that in many cases severely affected by staff shortages due to the self-isolation requirements and being pinged and told to self-isolate by test and trace. Remember, if they've been told, it still is a legal requirement to self-isolate. However, failure to self-isolate is putting others at risk, which, if we go back to the Health and Safety at Work Act, is still a requirement on individuals to make sure they make their employers aware of any known risks. So employees still have the responsibility to tell you if they've been pinged or if they've been told by test and trace. And similarly, you have a responsibility under the same act to make sure you put steps in place that they are not contributing further to the risks within your workplace. So in other words, requiring them to self-isolate and keep away from people till that isolation period is up. Next slide, please. So when reviewing your risk assessments, you need to consider each sport and activity the same as you did before, what controls you are putting in place. So you need to consider shared equipment. For example, exercise balls, who cleans them? Whether you're going to do it yourself or whether you're now going to transfer that responsibility to customers and inform them how to do it. You should continue to refer to your NGB guidance on specific sports. Most have reviewed them. Some will still be updating them and following best practice. But overall, I think you still need to consider all the issues that you were considering before. Occupancy levels, looking at how ventilation affects that, how you clean equipment, how you test and trace, etc. So you still need to keep thinking about those things and not just abandon them. As we said before, AHOs have still got the power to enforce. If they come in and find you've abandoned them, I think you're going to find yourself in for a hard time. So next slide, please. Many people still feel uncomfortable about the lifting of restrictions, and this may include your staff. So if we continue to remove restrictions completely and abandon some of the controls, as we've already seen in 1 or 2 facilities, there is a risk you will lose customer confidence and therefore lose members. Ensure you communicate what you're doing to customers. Keep your websites and social media updated. Keep them informed of the measures you're taking and how you're working slowly back towards getting back to a normal in a safe and effective manner. Make sure you communicate what you expect of customers, for example, not to visit if they've got symptoms, to continue to sanitize and use your booking in systems. And importantly, share your plans and controls that you've derived from your risk assessments with your teams. Make sure they know what to tell customers and how to actually operate safely. As I said, sadly, we've already seen in this first week a number of examples where we've been into facilities where that's been abandoned and the instructors and staff at the front level haven't been told what they should be doing to continue to advocate how to continue to operate safely during what is still quite a delicate period of time with case numbers rising so rapidly. You don't want all your staff off having been pinged or told to self-isolate, and they're continuing to do that despite being double vaccinated, and you don't want customers not feeling confident to come back in. So be seen to maintain your controls, exercise regular cleaning, use of face coverings, etc. And going back to Jonathan Van Tam, take baby steps, or as Jonathan said, don't tear the pants out of it. Let's do this safely. Let's do this in a considered and measured way so that you can rebuild your businesses for a long term and not one that sees us going back into further controls that are going to affect us massively. So let's work together and try and keep this moving forward well. Next slide. So just to recap, I think that might be review the guidance on the government website, refer to the HSE website, continue to check the guidance, check the Sport England for further guidance, keep your eye on UK Active and CIPSA websites, and for Right Directions clinics, give us a call. And if you want to become a Right Directions clinic, also give us a call, a client rather. And I think that's it until we get to the wonderful bit about questions, which I will now start looking at while Jill takes over.
Actually, Caroline, are you coming back on? Yep.
I'm here. Okay, so just very briefly, for those of you who are still involved in Quest, we just wanted to give you a brief update on that. We've still got Quest Prime running, which was the assessment that we devised for getting through COVID. We have updated that. That's now called Quest Prime Recovery, with the same modules that were in Quest Prime, but updated, taking out some of the guidance, the restrictions. If anybody's interested in joining us, we've got a clinic on the 12th of August at 10:30. So please, that is on the Quest website, which is questmbs.org. You can go on there and apply for the clinic at any time. If not, get hold of the Quest office, and we can put you on. We can register you on for the clinic. That clinic will go through all the modules, how it works, and what we're doing. So next slide, please, Jill. We're not going to go through this in any detail because we know we've got lots of questions, but if you need us, we're here. Give us a ring if you need any support. Next slide, please. No, over to questions. Ian, Jill, we're over to questions.
Okay, Ian, I've tried to clone the questions for you. The biggie I think that we'll do first is the ventilation and CO2. There's quite a few individual questions on ventilation around is the 100 square feet per person ventilation rate required, or has that now been removed?
I think if you look at the guidance now, they are really going over to the CO2 measure as being whether the room is properly ventilated. Clearly in big sports halls, you're going to be able to keep below 800 parts per million far more easily than in a small dance studio that will need good ventilation, particularly if you've got a large number of people in there exercising hard. And just as I didn't know how we could ever have ventilation systems in our building that could genuinely move 20 litres of air per person per second, which was the original, I'm not sure that everyone will be able to achieve the 800, but you will need to look at that we've been given guidance, you've been given guidance. Guidance is obviously a secondary form of issue that the health and safety executive can use to enforce against you, that you need to seriously look at and monitor and measure. And I believe that is the tool that we should be using, and the tool that will be used to measure whether we are adequately ventilating the areas. This is an airborne transmitted virus predominantly. We know about it, and therefore we have to try and follow this guidance. And it will be a case of trial and error. I think in many places you will see how you can build up the numbers in your classes, and you might well come to a tipping point where you decide that's the maximum number I can have in that room.
Thank you, Ian. Just on the back of that, you mentioned CO2 monitors. Just a couple of quite specific questions on monitors. The first one is, do facilities need to get experts in to help them with CO2 monitors? What is our advice for people who have probably never had to use CO2 monitors before?
I don't know whether you need advice. I think there is guidance on the HSE about how it's located and at what height. And obviously some of them come with it. I think you should try and get a reasonable quality one that comes with some form of calibration, and probably one that has got some kind of USB output so that you can download the data to help you analyse and make decisions in the future. We don't advocate a particular brand or variety because we ourselves don't know, but I think they are fairly, from what I understand, fairly easy to use. I've seen a number of clients use them and even have to take action fairly soon after implementing them. So I think they're fairly self-explanatory, and clearly if you're one of our clients, come back to us if you get into problems.
Okay, thanks, Ian. Just on the back of that, there was a question for someone from someone on the chat saying, has anybody actually bought CO2 monitors and can they advise? So if anybody on the clinic has and you think that they're working, if you can just put that in the chat for that client, that would be good. I have some quite specific questions, Ian, around individual items, so we'll clear those off now. Water fountains. What's our advice on water fountains now?
I would have thought to some extent this is common sense. I think we should keep with the same process we had where only hook taps are made available. And I think moving forward, knowing we've got a risk of winter flu, of the norovirus and winter vomiting, to be honest, the old days are the ones you used to put your face to it. They should never have existed in the first place. We should be taking those out long term and just providing hook tap variety to enable people to fill up water bottles that they bring along.
Okay, thanks, Ian. Next one, hairdryers. I know early doors we were advocating to take hairdryers out of action and hand dryers. What's our advice on hairdryers and hand dryers now?
I think they can be brought back in. You might want to put a sanitising pot close by. Again, in terms of social distancing, all of our customers and us as individuals have been asked by government to exercise personal judgment and personal control. I think we have to enable customers to exercise personal control and judgment, and therefore if we have a row of hairdryers all next to each other still in operation, we're not really doing that. So maybe we do need to think about how we space some of them out and maybe take the middle one out, but there should be no reason why we can't use hand dryers and hair dryers. It's far better that customers dry their hands properly rather than half wash them and then have wet hands that transmit probably other bacterial issues further than if they use a hand dryer and dry it properly.
Thanks, Ian. I know that during the presentation you talked about exercise kit being cleaned at the end of classes, sort of bikes and body pump kit. Question in, how about dealing with group exercise equipment which is shared through circuits and boxer size? maybe Omnia, HIT type classes. What is advice on shared equipment during the classes?
I think that's got to be down to the judgment of yourselves as whether your customers are going to be touching their face or in between using it, or whether having used it they're able to sanitize their hands immediately before going to touch their face or nose or eyes. So I think it's down to some extent to what the NGBs are saying about it, and also about how you're managing it and how you managed it through last time. I don't see there being a massive change until we know we get that extra percentage of people who are 18 to 30-year-olds vaccinated. I think we still need to put sensible controls in place. Absolutely.
And what about sort of on that customer perception, sort of passing kit from one to another, particularly boxer size gloves maybe?
If you found a way around it up to this point, I would keep with it.
Okay, thank you. Next question. So several in on this. I'm going to clone several together. Ball pits, foam blocks in soft play areas. What's our advice on bringing those types of equipment back into play within the facilities?
It's a difficult one. We know the main route of transmission is airborne. There clearly is some question over droplet transmission, but then there is a risk of other bacteria and virus transmission via that route as well. So I think we still should be advocating good hygiene, but I think it's more to do with the queuing and the distancing of people using that equipment that we should be thinking about, as much as the risks presented by people using that area specifically. I don't know whether that answers that question.
Okay. Thanks, Ian. If anybody in the chat and the people who put that question into the chat, if you'd like any further information on that, either put questions in the chat or come back to us individually. Okay, a very specific question around face coverings. I know that you've covered this. If a facility makes it mandatory to wear face coverings, it's their policy, can they actually enforce it within their facility? Obviously taking aside medical conditions, but if they've set the policy that they want all the customers to wear them, how can they enforce it? Can they enforce that?
I know that obviously public transport can, because it's under their license to carriage. They can enforce whatever controls they like within buildings. Clearly you've got this whole issue with customer care and customer confidence, so you've got a balance to make. I believe we can deny entry to anybody if we wish, but you clearly need to have grounds on which to do it. So I think it's the whole message still of maybe putting up correct things, knowing that you've got people within your workforce and other customers coming in that are still deemed to be clinically vulnerable, not yet vaccinated, and appealing to customers' better judgment to support what you're doing. And clearly, because some people think it is relaxed, you might need to provide a small stock of face coverings to enable customers to come in if they've simply forgotten. But I think it's a question of customer care and working with the customers to try and, if that's your policy, which we would fully endorse, to try and keep people aware that we've got to do something to make sure that these case numbers start coming down again and don't just keep escalating up.
Thanks, Ian.
I think I would also add there, if you are a local authority building organisation running a local authority building, that you should check with your client before you make any policies that they agree with them.
Thank you, Caroline. Okay, again, Ian, I know that we've covered test and trace during the clinic, but a very specific question. If a employee has been pinged and they tell the facility they've been pinged, but they want to come to work, what would be our advice?
I listened to a very interesting article on Radio 4 this morning about this with a solicitor talking about the law on this. If they've been told by test and trace they legally cannot come to work, they have to legally self-isolate and follow the guidance. If they've been pinged, it is strongly recommended that they follow the guidance. If they come in and tell you they've been pinged and they have a legal duty personally to inform you of that, you have to consider the risk to your business, to your other staff, to your customers. And you either have to work out, say they work completely alone, don't come into contact, you may make a risk assessment judgment. But if they are in contact with other people, it is in their interests and your interests that your risk assessment says they should comply with the guidance and therefore not come into work.
Thank you, Ian.
Can we, Ian, do you think it's also a good idea to get them to do lateral flow tests?
Yeah, that a part of that maybe that they should go off and get themselves a PCR test if they've been pinged. And that might help you in your risk assessment and judgment about whether they're able to work. But it is still strongly recommended, the guidance, that anyone is pinged should follow the self-isolation rules. There are some circumstances I could see, if they've been PCR tested, continue to take lateral flow, that might be, if they're working in an area where there's low social contact, lots of distancing, good ventilation, that it might not be an issue. But that's 2 or 3 days down the line after being pinged. If they come in and say, I've been pinged the day before, you really should not be allowing them into your workplace.
I can, from personal experience in the last couple of weeks, tell you that whilst my son knew on the Monday there was a good chance that somebody at the football had it, the symptoms didn't show until Wednesday. So it does take a while to come out. So even if they have been pinged, it might be that they don't actually see any symptoms for a while.
Yeah, and I know how frustrating that is for businesses. There's lots of businesses at the moment complaining, moaning about lack of staff and having the risk of having to shut down. So I think, it's an area that I hope government will give some greater clarity to soon, but at this point in time, you have to consider it in terms of your risk assessment.
Thank you, Ian. Can we go back to ball ponds and foam pits? There's just a couple of questions that have been added to the chat since we asked the question. So one is, sorry if they don't feel that we've answered the question, and that can they or can't they open the foam pits or ball ponds? It is around the risk assessment, isn't it?
It's around the risk assessment, and also I would imagine that the Play Equipment Association, the what's it called? The NGB for soft play will, I would imagine, update their NGB guidance fairly soon, and you certainly need to review that to see what they're saying. So.
It is around customer perception as well, isn't it? Yeah. Our advice is, and we've been talking to a lot of people this week on foam pits, is you've obviously put control measures in previously during the pandemic. If those control measures have worked for you, we would advise you to keep those in place. Regarding foam pits that you had closed and taken out of action, again, it's if the EHO of the HSE walked into your building, how can you demonstrate through your risk assessment that you are keeping that area clean and that you are in control of passing on the infection from one customer to another? So although we can't, this is a really difficult question, for us to say yes or no. We would need to look at individual foam pits and how you are cleaning those. But our advice in the first instance is, if you've had those working in a different way throughout this pandemic, then we would advise you to keep the foam pits working in that way during the next few months. Sorry, we can't be a bit more specific on that question.
I think we also need to add here that in the risk assessments, it's worth all centres just having a look at the rates in their areas. If you're on the Isles of Scilly and you've had no cases for the last 6 months, then your approach is going to be very different from if you're in an area. Who was saying they're in the worst hit area? Somebody was saying that they're somebody from Sport England, I think it was Redcar and Cleveland, have got the highest numbers in the country at the moment. If you're in that area, then your risk assessments may well be different, and your control measures, you may be putting more back in place rather than relaxing them. Do you agree with that?
Yeah, and
absolutely. That's a really good piece of advice, Caroline.
On top of that, for instance, in some areas you will have very, very high vaccination rates across all age groups. We know London, for instance, which has got a very young age profile, still has got very high numbers of people that are unvaccinated. So that's why I think I could understand why government did what they did. They basically said in some environments, we no longer need to legislate. We need to leave some of the decisions up to you as individuals. Some areas will be a lot safer than others. And I think you have to bear all those issues in mind when you're looking at your risk assessments. If you've got high case numbers, you've got a lot of people in your area who are still not unvaccinated, then clearly your controls will need to be higher than in other areas.
I also think it's around the demographics in the building as well, Ian. The cases are stronger in younger people. It's workforce, if there's a younger workforce, and if it's younger people using the facilities as well. So there's a lot of things we need to take into consideration within those areas.
We've just going back to foam pits. We've had somebody come in just saying British Gymnastics has issued some guidance on use of foam pits.
Yeah, and thank you, Carl, because that guidance, you do need to be a British Gymnastic member. But Carl's put his email in the group chat for us. We won't tell British Gymnastics, Carl. So if you want that guidance, ping Carl an email. And he will be able to send you that guidance, which at one point they were saying not to use the foam pits, but I know they're saying that they can be used now in certain instances. Okay, if we move on, can we look at fitness classes and gym capacities, Ian? There's a couple of questions that have come in around capacities of classes. I know we briefly touched on this during the clinic. So looking at whether we should have or facilities should have upped the fitness classes to the levels that they were before. And then around that, there's a question around the gym, that somebody has taken the gym straight back to normal operating levels of kit, putting all kit back in, and numbers of people to the level that they had before the pandemic. What's our advice on capacities for classes and booking systems and using kit in the gym?
I think we need to go back to what has happened. Government have said they are removing the legislation which put some of those strict controls on, but they are placing the burden and onus of responsibility on individuals and on employers and business operators to manage the risk themselves now. So I think, has the risk of viral transmission changed since the 18th of July to the 19th of July? It probably has got worse. So the guidance now is what we need to look at. It's still there. We still need to look at the guidance, and the guidance really replicates lots of the original legal requirements. So we still need to be considering how we are risking viral transmission within our workplaces, within our gyms, within our dance studios. And we need to be building on what we've already said, the new guidance on ventilation, which is quite clear. It does give some parameters now for us to work within that perhaps is a little bit more practical than 20 litres of air per second per person, and review how we are going to fit within that for your sake, for your staff's sake, and for the sake of your customers. So with CO2 monitors, you should be able to probably work out your occupancies. You'll know if you're pitching over the 800 and be able to take some measures to try and either improve ventilation or keep your capacity levels down. Similarly with distancing, they still asked us to think about maintaining social distancing. Although they've dropped the face masks, even if it's down to a metre, you need to be thinking about how your equipment is laid out, how customers are using it. So again, don't go back to having equipment face to face. Try and make sure the actions you're taking would be seen as reasonable and practical. If you got an investigation, you're likely to lose customer confidence if people keep saying, oh, I went to the gym and that's where I picked something up from. So please continue to review the guidance as earnestly as you were reviewing the legal requirements, and use it as government have said. It's down to us now through our risk assessments to make those judgments. I can't tell you what those numbers are. You can do it because you're the ones who work and operate in your buildings and know your rooms, know how well they're ventilated, and know your customers. It's down to us now, which is what government is saying.
Can I add a couple of bits? Can I add a few bits?
Yeah.
I've quest assessed quite a lot of centres in the last few weeks, and just a few bits from my end. Firstly, you've got very different classes, from high impact body combat HIIT classes to yoga and Pilates. Don't just up all the capacities to your full as they were. Think about the actual activities and think about the participants. If you've got 50 plus classes where people are vulnerable, or maybe they're not because they've been double jabbed, think about that. That's really important. And the other thing I think that's important to mention is that some gyms have gone back to full capacity because they weren't that busy in the first place. So again, think about your timings. You know, you could go back to full capacity in off-peak times, but full when it's peak time, you might decide not to. So don't just blanket approach. And the other thing I would say is, from every single quest assessment I've done, the feedback from customers has been that the booking of facilities, including lane swimming and gym, has been very, very well received by customers. They've really, really liked it. So take that into consideration as well. And that might be the case for other activities. So those would be my points. Don't just blanketly do something. Look at your capacities, your usage, your area where you're at, and who uses you as well, and who uses those classes. I mean, a full class of Pilates or yoga doesn't really matter. I'm sure the CO2 is not going to be high in that. Nobody's really breathing heavily. But just have a think rather than just blanketing approach. Ian, agree with that?
I fully agree. That's where the government has given the control back to you, but within the restraints of operating safely. And you've got to look at each case, each class, each venue, and make your judgments using the tools that are available to us.
And there's a really good quote from John. It's good to have John Matson back on the clinics. He's put a very good quote in the chat. So someone far wiser than me said this to me the other day: just because we can does not mean we should. And I think we try not to use the risk assessment approach at Right Directions with our advice, but we are having to say in this instance that you do need to assess your risks to each individual case, and I think Caroline's examples there were very good. Ian, I think the only other question in the chat that we've not covered is around have Right Directions issued any risk assessments, and yes, we have. And they are on our Stitch platform. We've got very comprehensive risk assessments for activities, staff, and for the building. So if you are interested in in looking at those risk assessments. If you email us at info@rightdirections.co.uk, we'll be able to give you more information on how you can access those risk assessments. So I don't think we've done badly. I think they're probably the most questions that we've ever had in the clinic, and we've had over 150 people on the call today, which is very good. I'm going to pass back to Caroline to close the clinic, and thank you as always, Ian, for your input. I think you have been put on the spotlight more than normal today, and I think you've given some really great advice there, so thank you. Caroline, over to you. You've muted, Caroline.
Oh, Jan, thanks Jan for putting the presentation together, and Ian and Jill for contributions today and steering the questions. I live on a flight plane path, so I think probably it's been a wonderful year of no flights going over my house, but I think probably just heard an EasyJet flight going over there. Good luck to everybody for reopening. I hope the cases don't escalate in your areas and your businesses are back up and booming. Ever so difficult. We totally understand that you're in horrendously difficult situations with a desperate need to get the clinic, to get the income back up in what is our quietest time for lots of organisations. Obviously outdoor pools, trampoline parks, etc. can be really busy, and we really hope you are. Difficult fine line juggling, and we totally understand. Good luck to everybody over the summer. Ian, any other comments you want to add before we go?
No, I just hope, as I said before, this might be one of the last. I really do hope that we see case numbers begin to fall again in mid-August, which is, I think, one of the triggers that SAGE are looking at as to whether more restrictions are needed. So let's all try and contribute to it, keep ourselves safe, keep our customers safe, and hopefully keep your staff being able to come into work.
And I mean, the only other thing I would do is having seen a 17-year-old with pretty nasty symptoms last week, I am absolutely bloody pleased to bits that I've been double jabbed. So I would, if I were you, encourage anybody that you know that hasn't been jabbed yet. It's probably one of the best things that they can do. We've certainly not suffered, and I'm sure we would have done had we not been jabbed. So thanks ever so much for everybody attending. By all means, give us, keep in contact if you've got any more questions, and we wish you all the best of luck over the summer.